Good day, everyone. We are group number 3, and we're gonna talk about health concerns, which is a Philippine national issue or problem. So in this video, what we're gonna talk about are the following. First, definition and background, what the national issue or problem is all about. Second, main causes, the problem's main causes. Third, the effects on the nation and the Filipino people. And lastly, the steps, activities, projects, and programs. Definition and background.
The national issue is about health concern. Health concern by definition is a health-related matter that is of interest, importance, or worry to someone, who may be the patient, patient's family, or patient's healthcare provider. Just like any other countries, there are several health concerns that the Philippines is facing right now that are making headlines other than COVID-19, which is the most widespread today. Starting off with mental health issues, which became recently rampant because of the mandatory quarantine and isolation in the means of preventing the spread of the virus. Then the list goes on with health issues concerning diabetes, tuberculosis, dengue, HIV/AIDS, cervical cancer, substance abuse, and more.
These are the problem's main causes.
The main causes of the various health concerns in the country are the following: lack of knowledge regarding health and wellness, low economic status of the country, poor nutrition and lack of food security, living unhealthy lifestyles, increasing environmental risk factors, and ineffective health system.
The effects on the nation and the Filipino people.
Health concerns in the Philippines have been a problem for a long time. Filipino people with little to no income have very limited access to basic healthcare, and even if they do manage to get a hold of basic healthcare, they somehow end up in large debt. The country has a high mortality rate and a high fertility rate due to most of the population in the Philippines not having access to basic healthcare and basic sex education.
These are the steps, activities, projects, programs that the government, national or international organizations, and even individuals are doing to help solve this problem.
National Dengue Control Program. The NDPCP is directed towards community-based dengue prevention and control in endemic areas. Cancer Prevention and Control Program aims to develop a comprehensive approach and strategies to increase awareness, information, and continuing education of health personnel, high-risk individuals, and patients. DOH Complete Treatment Pack Program, a medicine access program designed to reach the poorest of the poor with complete treatment regimens for the top most common diseases in the country. Adolescent Health Program aims to promote the total health and well-being of young people through youth-friendly comprehensive healthcare and services on multiple levels: national, regional, provincial or city, and municipal. National TB Control Program. The program aims to reduce morbidity and mortality from tuberculosis by scaling up and sustaining coverage of DOTS implementation, ensuring provision of quality TB services, and reducing out-of-pocket expenses related to TB care. Malaria Control Program aims to significantly reduce malaria burden so that it will no longer affect the socioeconomic development of individuals and families in endemic areas. National HIV, AIDS, and STI Prevention and Control Program. Aims to prevent the further spread of HIV infection and reduce the impact of the disease on individuals, families, sectors, and communities by improving the coverage and quality of prevention programs for persons at most risk, vulnerable, and living with HIV. Tobacco Control Program aims to reduce the prevalence of tobacco use and decrease the overall ill effects of tobacco through policies and legislation on tobacco control.
The world is far healthier than ever before. Global life expectancy is increasing in most countries, and diseases like AIDS, tuberculosis, and malaria are on the decline. Despite decades of progress, plenty of work remains. Every year, more than 6 million children die before their 5th birthday, the majority by preventable causes. Rates of asthma are increasing among the young and the old, and a virus like H1N1 can spread from San Diego to Shanghai in only a matter of days. Those who are tasked with improving global health face 3 major challenges: non-communicable diseases, or NCDs, infectious diseases, and funding for treatment and prevention. Non-communicable diseases like cancer and diabetes are the world's biggest killers. In 1990, 3 of the top 7 global causes of death were NCDs. In 2015, it was 6 out of 7. This is in part because global life expectancy and standards of living are on the rise. As countries get richer and their populations get older, people are increasingly exposed to the risk factors of NCDs, such as a sedentary lifestyle, increased substance abuse, and access to processed foods. In Africa, cancer now kills about 450,000 people annually, but by 2030, that rate is projected to climb to almost 1 million people each year. Non-communicable diseases often require extensive long-term care, and access to affordable treatment can be a major obstacle in both developing and developed countries. Unlike NCDs, the rates of infectious diseases are down worldwide. However, they still present a major global health challenge because outbreaks are difficult to predict and just as hard to prepare for. The 2013 Ebola epidemic killed thousands in West Africa. More recently, Zika has been linked to birth defects in children throughout Latin America and the Caribbean, and it has scared off tourists from the worst-hit countries, costing local economies billions of dollars. Health officials can only do so much to respond to infectious diseases because viruses spread undetected and mutate rapidly. It becomes a race to protect the healthy and quarantine the sick. In the face of an outbreak, international coordination can reduce the odds of a disease spreading to other countries. But with a crowded cast of 40 government-to-government donors, 25 UN agencies, 20 global and regional funds, and 90 global initiatives involved in any serious outbreak, coordination is a challenge. It can be difficult to even determine who's in charge. The World Health Organization could be taking a leading role. It was established after World War II for that specific purpose. But today, its capabilities and resources are no match for the proliferation of global health problems. Instead, the majority of funding for these organizations comes straight from the so-called two Washingtons: the Gates Foundation, which gives 68% of the world's private donations in the realm of health, and the U.S. government, which provides 52% of all public funding for global health. While crucial to maintaining health programs around the world, especially in low-income countries dependent on foreign aid, the concentration of funding for these two sources makes the whole system extremely vulnerable to personal and political developments. In 2000, 189 countries made a historic commitment to improving the lives of the world's poorest citizens, which became 8 specific Millennium Development Goals. 3 of these were health-related. In 2015, the UN replaced these objectives with 17 Sustainable Development Goals, 11 of which deal with improving global health outcomes. Finding new ways to effectively respond to non-communicable and infectious diseases and overcoming funding challenges will help achieve these goals, which are more important than ever before, because in an increasingly connected world, health in one country affects health in all.
And that is all for our discussion. Thank you all for listening and watching. I hope you learned something about the health concerns.